demo I'm going to show is a generative AI powered community health needs assessment. This is a diagram that kind of shows an overall view of how this works. So this green box shows what our software is doing. I'll show you a really quick view of our software. This screenshot is actually Syntasa software, and this is how we use our software to ingest all of this kinds of data. Here we're pulling in search data, census data. Phoenix is a public health data warehouse, has a bunch of public health outcome metrics for the state of Michigan. Here we're bringing in social, media, news. All this data is brought into a private GCP account. So all the data stays within the customer's control. And Google GCP, I will just add here briefly, has a feature called assured workloads that makes it very easy to comply with regulatory requirements like FTI or CGIS or any kind of the different regulatory regimes that you may need to comply with in your project. So here we're bringing in, this is a project we did for the city of Dearborn. So we're bringing in data from the city, from the Phoenix public health metric outcome data warehouse I mentioned. This is work that's done by Wayne State University in the Detroit area. Dearborn is also in the Detroit area. So we're bringing in search data from Google Trends and news and social data, census data. We also were planning to bring survey data. A lot of CHNA reports are very heavily reliant on survey data. This is from the Maryland Public Health, the Michigan Public Health Institute. And we were planning to bring that data in. It wasn't available by the time we finished this project, but this is basically pre-built to include that kind of data. We consolidate it all, and then we build Looker dashboards in Looker. Looker is another Google tool used to build dashboards to cover the different areas that are typically included in a CHNA. So if you look at a typical community health needs assessment report, it includes sections about the community of focus, health outcomes in those communities, feedback from that community, access to healthcare, and social determinants of health. These are all areas that are covered in that report. And so we have built dashboards to cover these areas. And then we pass these panels, dashboard panels, to Gemini. And we ask Gemini to describe the situation that's happening in this dashboard panel and identify any health needs based on what it knows about the data and the dashboard visualization panel. And then we ask Gemini to write the first draft of a CHNA report. So I'm going to show you the report itself in a minute, but this is just kind of a small example of an output. So this is a example of a dashboard panel, a visualization panel. Down here, you can see, I don't know if you can see at the bottom, there's an icon with a T and then it says AI generated. So this is indicating that all of this text, this description of this figure was all generated by Gemini. And this is basically Gemini writing the first draft of the report. These reports, they are very much survey driven. The kind of way that these reports are typically done, they're usually done about once every 3 years. It does heavily rely on a survey. It doesn't necessarily take into account many of the other data sources I mentioned before. And writing the report can take 6 to 9 months. So having a system like this that's automatically keeping up to date with the latest data from all these data sources and is able to write a draft report very quickly enables the CHNA to be done faster. CHNA is also typically used to figure out what the most pressing public health priorities are in a community and apply for grants to get resources to address those public health needs. So let me switch to the report that we generated here. So this is a document. This is in Google Docs, and this is a prototype of a CHNA 2.0 report. This first part of the document was written by, it's just an introduction. It's written by us, and it describes the approach to the document. And once we get to the findings, here we start to see where the Gemini has created or generated this text. So again, you can see this is AI generated summarization of the community, of the Dearborn community and demographics. Here's AI generated text that's drawing insights and identifying public health needs based on the data that's in there. And this is I think it's a 37 page report where, you know, the final 2/3 of this report was all generated by AI. So we were honestly not really sure how well this was going to work when we started this project. We're very interested in innovation, and we get very excited about applying new technology to behavioral health and public health. We were really impressed at how well Gemini performed in this project, and think it has a ton of potential beyond just this project. So thinking about the vision, like what more of a role can generative AI play beyond what I just showed you? Having data be kept up to date, having Vertex identify the most relevant data and visualization panels, and then having Vertex generate that draft content. Then a public health professional can review that content. They can, like I showed you in the first demo, give thumbs up, thumbs down on whether they think the data and the panel and the content are relevant or not. And also, we want to add a CHNA expert agent. So the idea here would be, this would be an agent that would be trained on kind of best practices CHNAs that have been collected from a lot of different communities. And it would be a resource that public health professional can use to ask questions about best practices for CHNA.